Best flu prevention tips. Most seasonal flu activity typically occurs between October and May, but it most commonly peaks between December and February. It's that time of year when the flu virus makes its annual rounds, and last year was particularly rough. If you end up being one of the lucky people who don't get sick this season, then you'll probably know someone who does. It's one of those things that's pretty hard to escape, especially if you live with children or frequent high-traffic public places like gyms, schools, hospitals, or any form of public transit. Each one of us is bound to come in close contact with the flu virus at some point this season, but the key is how we protect ourselves against it, which means following the proper precautions and etiquette. There are available alternatives such as good hygiene or antiviral medications to dodge the illness. To avoid getting sick this winter, take note of these easy flu prevention tips. Preventing the flu without shots. Short of getting the flu vaccine, there are many steps you can take to lower your risk of getting the virus. We are calling it respiratory hygiene. Walter Stamm, MD, professor of medicine at the University of Washington in Seattle and president of the Infectious Disease Society of America, tells WebMD. The most important thing you can do, Stamm says, is to wash your hands frequently. You would be amazed how often adults, not just children, put their hands in their mouths, he says. Although the flu virus is airborne in droplets of breath, the majority of it is probably passed by hand, according to Stamm. The Joint Commission on Accreditation of Healthcare Organizations has joined with a raft of other medical professional groups to recommend 3 easy steps to prevent infection with the flu, especially during a time when there is a shortage of flu shots. Clean your hands for 15 seconds. Soap, warm water, and a period of vigorous rubbing will wash viruses down the drain. Do this every time you sneeze or cough, and especially before meals. Those alcohol-based hand cleaners are also good to have around the house or in a pocket or purse. Cover your nose and mouth when you cough or sneeze. Use a tissue rather than a cloth hanky, or cough into your sleeve in the crook of your arm. Then wash your hands. The advice may be aimed at keeping viruses off your hands. Vincenza Snow, MD, Director of Clinical Programs for the American College of Physicians, tells WebMD, avoid close contact. Stamm jokes that this advice means fly first class. In a more serious vein, you should avoid crowded public places. And if you do feel ill, flu is characterized by rapid onset of fever, chills, and horribly aching bones. Stay at home or keep your child at home. Do not go into work. Do not even run to the emergency room unless you have trouble breathing or a sky-high fever develops. In the hospital, you and your family will be surrounded by infectious people. People with the flu feel so terrible, they usually don't go anywhere, Snow notes. Stay away from others who are sick. This one seems obvious, but you'd be surprised how many people still interact with friends and family members who are sick. The flu is extremely contagious and easily passed from person to person, especially if that sick person is sneezing and coughing into the air around them. In an interview with Cosmopolitan, Dr. Amesh Adalja, MD, an infectious disease physician, spokesperson for the Infectious Diseases Society of America, and senior scholar at Johns Hopkins University for Health Security, said the flu virus can travel up to 3 feet through the air inside small droplets that are released when someone sneezes or coughs them out. To help prevent the virus from spreading between family members or roommates, you should do your own dishes and definitely don't share a plate of food. You don't want anything that has been in a sick person's mouth to end up near something that will be going near yours. The same advice goes for those who are sick. Stay at home. Even something as innocent as running errands or going to school can put others at risk. The biggest conundrum is people who are sick and most likely still contagious that go into work. These are the people who don't want to waste their sick days or fall behind on work, but sick days are there for a reason, so use them. The Centers for Disease Control and Prevention, CDC, advises people to stay home for at least 24 hours after the fever is gone, without the use of a fever-reducing medicine. Other recommendations include getting plenty of rest, eating a healthy diet, drinking plenty of fluids, and getting plenty of exercise. Sleep is one of the best things a person can do to keep themselves healthy and in good shape to fight off illnesses. Having adequate sleep is a good habit for optimal immune system functioning and to prevent respiratory viruses like the flu, says Dr. Adalja to Cosmopolitan. According to the National Sleep Foundation, the average adult needs about 7 to 9 hours of sleep each night. A good diet for preventing flu include chicken soup with mushroom, eat more garlic raw, smash it and wait 5 minutes then eat, onion raw, ginger, seeds and nuts. According to the American Council on Exercise, research has shown that moderate exercise, such as brisk walking, brings about measurable changes in the immune system, sending white blood cells zipping around the body to find intruders and kill them. But after a few hours, the immune system returns to normal, so it's best to exercise regularly. Rita Beckford, MD, a spokeswoman for the American Council on Exercise, also cites studies that show that those who exercise 4 to 5 times a week are less likely to get colds or other viruses. What to do with the flu? Most healthy people will recover from the flu in 7 to 10 days, and luckily, the worst symptoms go away within 4 days. Most drugstore regimens aim to lessen these symptoms. If that's not enough for you, consider an antiviral medicine. Most people are unaware of 3 antiviral medicines: peramivir, Rapivab, oseltamivir, Tamiflu, and zanamivir, Relenza, available from your doctor, which can cut the severity of flu and shorten the duration of symptoms. But these only work if you start them within 2 days of contracting the flu virus. In addition, websites and drug stores are filled with herbals, vitamins, supplements, and other remedies that claim to treat the flu or improve symptoms. Some swear by homeopathic remedies, but others scorn them. Once you get the flu, most experts recommend bed rest, plenty of fluids, over-the-counter fever reducers and ache alleviators, a light diet, and good old chicken soup. Fitness instructor Beckford also recommends that you not exercise until you are well. Thanks for watching. Like, share and subscribe to my channel. Be healthy.